Hi, I am Dr. Ritesh Sharma. I am interventional pulmonologist and sleep physician at Mediclinic Al Noor. Today we are here to discuss regarding obstructive sleep apnea. In the patients having this problem, there is a blockage of the upper airways that ultimately disturbs your sleep and you have a problem in breathing. In this, the thorax and the diaphragm, they have to work very hard to bring air into your lungs, and sometimes your breathing stops. It is ideally an iceberg of diseases. You may breathe again with a loud gasp or sometimes with body jerks. In this, you may not sleep well, but you will not come to know what's exactly going on. The patients of obstructive sleep apnea have symptoms of early morning headache. They have irritability in their behavior. They don't sleep well in the night. They have problems of hypertension. They may have problems of gastroesophageal reflux diseases, and this disease actually it affects the sexual life of the patient. They have low libidos. So these are the symptoms that we commonly see in patients of obstructive sleep apneas. The most common symptom in this problem is snoring, that usually your partner explains you that you snored in the night. Sometimes you feel that in the night when you were sleeping, you just wake up scared that you cannot breathe. Some patients, they record high BP and they have a disturbed sleep throughout the night. So how we diagnose it? This is the thing, and who are the patients who are at the risk? So first I will tell you the patients who are at risk. The patient who has got obesity and who has got BMI more than 35, who has got hypertension, who usually complains of tiredness, the patient who has got a neck circumference of more than 17 in males and 15 in females. And basically we have seen that in this problem, males are at higher risk of having obstructive sleep apneas. So these are the symptoms and these are the patients which I explained you who has a risk of obstructive sleep apnea. So the question comes, how to diagnose this problem? So we have two ways. First is the clinical history that we usually take when the patient comes to us in the OPD. We have a list of questions that we usually ask and we assess according to the clinical severity. And then secondly, we advise for the polysomnography. It's a very normal study that we are doing here in Mediclinic Al Noor. In this, the patient has to come in the hospital, he has to stay here throughout the night and he can leave early morning. And the next day, we assess the sleep study and then we invite the patient to discuss regarding the results. In this, after reviewing the results, actually we have mild, moderate and severe categories, and accordingly we advise the patient for dietary modifications, for lifestyle modification, whether he requires any CPAP or whether he requires a surgery. Thank you. Have a nice day.